is these products are not just for broken bodies. These products help keep us healthy. And they're all about prevention and wellness. That's what we're about.
My responsibility is to share an opportunity with people, but they have the responsibility to take this opportunity to grow with it and to be the best they can.
To go out there and show people that there is another way, the people that have been written off by the medical profession and said there's nothing else, you must live with what you have forever, I'm going to show them that there is another way.
As a business, I decided that I would really enjoy the opportunity that gave me to actually teach my patients other ways that they could make their lives to work as well.
I saw a way to help impact people in a tremendous way. Right now, for instance, right now, I'm impacting maybe hundreds of people at this very moment with products that they're using on a daily basis. To me, that's exciting. Also, from the business perspective, I saw a way for me. I was working harder for less, and that's why it wasn't fun. I love the patients, I love the human interaction, but that it just wasn't fun anymore. And now, for instance, I have a 4-week vacation scheduled with my children in August. There was never a way I could ever think of doing that in podiatric medicine. So it's an exciting way. It was an exciting way for me to still stay in the health field, but impact people in a more profound way.
Instead of spending all my time fixing people when they're broken, which takes a lot of time and effort, tremendous amount of stress, and not much sleep sometimes, I decided to be in the business where I can actually help people stay well, and that's what NECAN is all about.
Now, never in my wildest dreams could you tell me that I would be in a multi-level marketing organization a couple of years ago. I said, you're crazy. I never thought I'd do any other business than medicine. But then I started seeing the power in it, and not just the financial power, but the power to affect so many lives. My influence that I can have on people one-on-one in the office is really very small. When I realized the vehicle that we have here, and the whole business, the whole concept of leveraging your time and the multi-level marketing aspect of affecting so many lives has just been tremendous. It's just really been wonderful.
I have helped hundreds of people, probably close to 1,000 in the last couple of years, through these wonderful products that we have. A week does not go by, and almost a day does not go by in my office that someone doesn't call me to thank me for how they've been helped. I cannot explain the gratification and the feeling that one gets. We've been hugged, kissed, and blessed through these products.
This company is all about humans being more. It's about it with the products, it's about it with the financial opportunity, it's about it with the philosophy and how you all behave towards each other, towards your friends, towards your cross line. This is going to change the way we take care of each other. It's going to change the way people take care of each other in the world. I'm very proud to be part of this business.
I'd like to conclude with a few comments. I'd like to read from you an excerpt from this article entitled "The Doctor is Not In," on the managed failure of managed care. 2,300 Massachusetts physicians in December of last year signed a despairing manifesto in the Journal of the American Medical Association. And I quote, "The time we are allowed to spend with the sick shrinks under the pressure to increase throughput, as though we were dealing with industrial commodities rather than afflicted human beings. Physicians and nurses are being prodded by threats and bribes to abdicate allegiance to patients and to shun the sickest, who may be unprofitable. Some of us risk being fired or delisted, forgiven, or even discussing expensive services, and many are offered bonuses for minimizing care." Ladies and gentlemen, this manifesto points only in one direction. And that direction is that we need to move toward prevention in the world on a global basis. I'd like you to join me in showing your appreciation to these physicians who represent the pioneers of the new wellness as we move into the new millennium. Ladies and gentlemen, I present to you the doctors panel. Thank you very much.
Hi, Bob Purdy, podiatrist. I attended the University of Louisville, the Ohio College of Podiatric Medicine, did my residency at the Foot Clinic of Youngstown, and I'm currently president of the American Academy of Podiatric Practice Management. Now, one of the questions we're supposed to answer is, did the change in healthcare in the United States affect my decision to enter NECAN? My decision was strictly based on the fact that I was impressed by what Dr. Stan Bogus told me. The other thing is, what is my why? Why am I in NECAN? Why would a doctor want to do NECAN? When I was in practice, I had a busy practice, and I could see 30 or 40 patients a day. Now today, I've been here all day, and I've probably helped several hundred people today. Not personally, but through other people. And this is an empowering business. It empowers me to help a lot more people than I could ever help as a solo practitioner.
Thank you, Bob.
Hi, we're real excited to be here today. I'm a practicing dentist in Fanwood, New Jersey. I'm a graduate of New York University School of Dentistry. I was on the staff there as a professor of oral diagnosis. I've co-authored over 15 textbooks. I'm in practice for 30 years, working a 10-hour day in my office as a solo practitioner. Happen to enjoy my profession, but also enjoy NECAN. We've looked at this business strictly from the residual income and the numbers of people that we can help. We have a vision of where healthcare is going in the future. In our office, we have seen 2 generations now of children that have come through the office that do not have dental decay, and perhaps that's why I need another job. However, we're excited to be here and share some information with you and be happy to do that.
Dr. Larry Bauman.
Good afternoon. I'm Jerry Friedman. I come from Rogerstown of eastern Pennsylvania, and actually I'm in this because of Roger and his dedication and interest in the field. I'm a general thoracic and vascular surgeon, board certified, fellow of the American College of Surgeons, fellow of the International College of Surgeons. I've been on 2 prominent medical faculties, currently in private practice. And for years, I have heard, in the 25 years I've been working, an average of 16, 18 hours a day, I've been hearing, "Oh, doctor, take care of yourself because we don't know what we'd do without you." That sounded marvelous to me because rarely did I ever get a thanks for bailing people out of their ill health. And then suddenly managed care came in. Managed care told people they had to go to certain doctors and had to do certain things. And all these people who wanted me never to retire said, "We're sorry. We have to go where our company directs us." And I suddenly realized that the effect that I was having was patching up people and not really helping them, and not really making any major inputs into their lives, into their wellness and how they were doing. So I decided that something like NECAN made much more sense, where I could take people before they came to me in desperate need and were very sick and required all of the expertise that I had in a field that really isn't just pure science, to be able to try to get them better. And it makes much more sense, as all you people are here thinking about now, is trying to keep people to stay healthy, to make an impact on them by providing them with the means to improve their health and maintain it, rather than wait till they have to come to me in broken pieces. Thank you.
Dr. Jerry Friedman.